Hi guys, it's Dr. Gibson again. Welcome back to my YouTube channel. Thank you for joining me today. Today we'll be talking about intermittent fasting, and the question of the day is to fast or not to fast, or to eat or not to eat. They're basically opposite sides of the same coin. So here's a thought: we all fast. I don't know of anyone who is able to eat and sleep at the same time. But of course, over the years, this sleeping window has decreased to about 6.8 hours on average. So what about if we extend that fasting period? Does it actually allow us to live healthier lives in the short term or long term? We've talked previously about diets and what to eat, and now we will be talking about the how and the when of eating. So what is intermittent fasting? Intermittent fasting is when we choose a period of time, generally between 10 hours to days, where we don't eat or where we have minimal caloric intake. And there are various types of intermittent fasting. It could range from alternate day fasting to time-restricted eating, to prolonged water fastings, to the 5-2 rule where you eat 5 days normally and 2 days of fasting, to 25-5 plan, where 25 days are normal eating and 5 days of fasting. So what we can think about is a lot of the chronic diseases we have now are diseases of excess caloric intake, excess weight gain, and poor food choices. So here's the question: is it possible to reverse all this and to starve our way to health? There's a famous quote that says, "He who has eaten himself sick must fast himself well," or something like that. So today we will talk about whether starvation can really help to cure chronic diseases. So there's an interesting term called hormesis. And this means that you actually expose the body to something that is potentially damaging, but in a low dose, it actually has beneficial and an adaptive effect on the cellular health. And this is something that, for example, we see with Wim Hof. I don't know if you all know him, but the Iceman. So small doses of cold therapy has actually been shown to improve the immune system in several of his followers and in Wim Hof himself. So this is kind of like an interesting phenomenon. So let's talk about intermittent fasting with regards to our chronic diseases. Diabetes mellitus type 2, or the regular type of diabetes, affects about 34.2 million Americans. Intermittent fasting has been shown to decrease fasting blood glucose, decrease insulin levels, and decrease insulin resistance. In fact, it has actually been shown in certain people to cause remission of diabetes. There was a small study in which 90% of diabetics who were less than 4 years into their diabetes diagnosis actually went into remission after intermittent fasting. So there's a lot of potential here, and this actually shows us better numbers than even bariatric surgery. What about hypertension? Well, for hypertension, there was a small study in 2001 with only about 174 people, and it was very intense. I mean, we're talking about 10 to 11 days of water fasting only. But the results were phenomenal. The majority of patients achieved a systolic blood pressure less than 140/90. In fact, most of them on average had a reduction in their blood pressure, the systolic, in terms of 37 millimeters of mercury. And those who were the worst hypertensives with systolic blood pressures over 180 had up to a 60-point decrease in their systolic blood pressure. That's impressive. I mean, these are small studies, but when we think about it, it's hard to find people to enroll in these type of studies and to maintain it long-term as well. What about cancer? So intermittent fasting has been shown to reduce the side effects of chemotherapy on the patients, fasting just for 24 to 48 hours. Of course, it's not recommended that if you're losing a lot of weight or really thin and frail from your cancer diagnosis to actually try this, but this just tells us that there's some sort of healthy cellular benefit to the caloric restriction. A lot of the data we have about intermittent fasting is actually from lab rats. We have limited human studies, but the data on the lab rats themselves, it's really impressive. Let's look at something such as IBS. So people who actually fasted for 10 days showed a significant reduction in symptoms from IBS. But of course, most of us who would even entertain intermittent fasting would be looking primarily at the weight loss benefits. So what does the data show about intermittent fasting and weight loss? So in terms of intermittent fasting and weight loss, it has been shown that about 12% of participants who underwent intermittent fasting actually maintained their weight loss after 1 to 2 years. Of course, initially there were substantial weight loss benefits, which eventually decreased with time. But compared to traditional, really professional dieters who on average only about 5% keep their weight loss sustained, this is impressive. So intermittent fasting might actually be the jumpstart we need to kind of get the weight loss going. You have to think about detoxing the body from all this hyper salty and hyper sweet food. When we fast, we basically try to normalize our taste buds, and when we reintroduce foods, they actually become more palatable instead of dampened down by this excess salt and sugar. We need to be careful though with fasting. After about 1 week, our body starts utilizing muscle for energy. So basically after about 12 to 36 hours, once glycogen stores are depleted, the body starts breaking down fat, which is very beneficial. The maximum fat breakdown benefits occurs at about 24 hours. As we go longer and longer into fasting, the brain has to find glucose to function, and the brain can't live off fat. So muscles are broken down to glucose for energy for the brain. Remember, our brain uses about 20% of the glucose of our entire body, so that's a substantial amount. And we can never starve our brain. And of course, if you exercise during prolonged fasting, this is just going to make this cannibalistic state worse. So just a word of caution when attempting to do prolonged fasting, please ensure that it's medically supervised. But just to throw something in there, if we add just a little bit of honey intermittently to our fasting and provide that glucose for the brain, it decreases the percentage muscle breakdown to about 50%. So that's a pretty decent improvement. Let's move on to alternate day fasting. So that's when we eat 1 day with normal calories and subsequent day with either 0 or a very low calorie intake. This has been shown to have also significant benefits in terms of weight loss. When patients resume their regular diet days, they actually only consume on average about 20% more calories. So sort of balancing that overall would mean they consume about 120% divided by 2 days, about 60% of their caloric intake per day instead of the usual 100. So there's a significant caloric reduction. It must be noted, however, that there was a lot of variation here. So some people would only increase their caloric intake on feeding days by 7%, but this could go up to 110%. So the person who was actually more than doubling their caloric intake actually had an adverse effect from this alternate day fasting. So let's talk a little bit about insulin-like growth factor 1 or IGF-1. So you may have heard this a little bit more in the media, especially in reference to longevity and fasting and certain type of cancers. So this hormone basically has been found to be reduced by fasting as well as by eating plant-based protein. Animal-based protein has actually been found to increase IGF-1 overall. And fasting basically over 13 hours is kind of like that window that has been shown to reduce the IGF-1 in most people. We're all different and not everyone will have the same response. IGF-1 levels, elevated levels, have been found in association with colorectal cancer, breast cancer, myeloma, as well as various other cancers. It's actually thought to accelerate the aging process. So low levels of IGF-1 might be seen in people who have decreased aging, longevity, as well as less cancers. But again, this association is not 100% understood and not 100% clear. So let's talk about another word. This is called autophagy. So autophagy is basically the process in which the body takes old damaged cells and recycles them to build new ones. Intermittent fasting has been thought to actually improve this process. And now we will move on to the fasting mimicking diets. And this was popularized by Prolon, in which you basically fast 5 days a month. So that's the 25-5 rule. So you eat normally for 25 days, and for 5 days you get this pre-packaged meal that has low-calorie foods that are that provide energy and are actually low-calorie. This has been proven to have similar metabolic effects to fasting in terms of there's decreased waist circumference, decreased BMI, decreased percentage fat, there's decreased levels of IGF-1, as well as inflammatory markers, including high sensitivity CRP, fasting glucose, and LDL. So definitely has shown some proven metabolic benefits. We'll move on to time restricted eating, which I think is perhaps the most sustainable form of intermittent fasting, because basically for this, all we do is extend our fasting window little by little and close down our feeding window. So generally this would be sort of like a 16-8, so 16 hours of fasting, 8 hours of eating, or a 14-10, so 14 hours of fasting and 10 hours of eating. This seems to be more sustainable. It's something that we can do gradually, and you can actually pick the when of it, which is really important because some of us prefer to eat early in the morning and some of us prefer to eat at night. So let's talk about who should not fast. Fasting is not for children, so people less than 18 years should not be fasting. Also, people who are diabetic, type 1, or are brittle diabetics who have like really wide fluctuations in blood sugars should really not be doing intermittent fasting. Also consider people who have a toxic relationship with food or have eating disorders. This is definitely not for you. People who have bad heart failure or who are cachectic or have significant weight loss, you probably should not try this. So let's summarize intermittent fasting. Could the lack of food be thy medicine? It certainly could. Intermittent fasting definitely has metabolic benefits. But here's the thing, it's hard to sustain, similar to calorie restriction. But we know that intermittent fasting has been shown to cause disease remission in certain chronic diseases such as diabetes and hypertension, can cause significant weight loss, decrease inflammatory markers, decrease IGF-1. So there's a lot of potential for intermittent fasting to have really healthy metabolic effects. So in summary, fasting does have metabolic benefits. Fasting has benefits on control of diabetes, hypertension, and improvement in obesity, as well as many other metabolic parameters. There's decreased inflammatory markers such as high sensitivity high sensitivity CRP, as well as IGF-1. So why don't more people fast? Well, a lot of times this type of eating pattern is difficult to sustain, and people have really focused more on extreme measures in terms of fasting, such as extended water fasts. For me, I think that the more sustainable option would be something like time restricted eating, where you get to choose, number one, how long your fasting period would be, and number two, what time period you actually choose to eat. So remember, as long as you have that 14-hour fasting period or that 10-hour eating window, you will still have similar metabolic benefits. So once again, I'm Dr. Gibson. Thank you for joining me today. Please like, subscribe, and comment below for other health topics that you would like for me to discuss. Until next time, bye.